So while WHO and health workers fight COVID-19 in the front lines, let's help in the fight by making ourselves stealth transmission proof. How? Number 1, wear the right mask. The WHO recommends medical masks to health workers, elderly, people who have underlying conditions, pregnant women, and people who tested positive or who have symptoms of coronavirus disease. If you don't belong in those categories, the WHO recommends the use of cloth masks. And since then, a lot of cloth masks have emerged. But do take note, different kinds of cloth masks offer different kinds of protection. Researchers at Florida Atlantic University conducted a study comparing the 4 types of face masks commonly used by the public: a stitch mask with 2 layers of fabric, a commercial cone mask, a folded handkerchief, and a bandana. Researchers tested each to see which would likely offer the best protection by measuring droplet blocking efficiency when a person coughed or sneezed. And their study showed that the stitch mask with 2 layers of fabric performed the best, with droplets traveling 2.5 inches, followed by the cone-style mask with droplets traveling 8 inches. The handkerchief performed worse, with droplets traveling 1 foot and 3 inches, and the bandana gave the least amount of protection, with droplets traveling about 3 feet. So when buying cloth mask, try to check if it's 2 or 3 layers. If you prefer to make your own, try to create hybrid masks. Hybrid masks are masks made out of 2 types of fabrics. Researchers in the UK found that combining 2 layers of 600 thread count cotton with another material like silk, chiffon, or flannel filtered more than 80% of small particles less than 300 nanometers and more than 90% of large particles bigger than 300 nanometers. They found that combinations of cotton and chiffon offered the best protection, followed by cotton and flannel, cotton and silk, and then 4 layers of natural silk. But even if you have the right material, if you don't wear it right, the mask protection decreased to 50% or more. So, apart from the right material, you have to wear it right and you wear it tight. If you find this video helpful, don't forget to subscribe, like, and share with someone who needs to know about it. Thank you for watching and see you next week on another episode of Corona V Up Close and Evidence-Based.